You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with gum disease. According to my first guest, he says no more bleeding gums, bad breath, loose teeth, and we're talking about laser dentistry today. With us we have, in fact, he was one of the first in Florida to have this laser that kills this bacteria associated with gum disease. With us we have Dr. Fred Eck. Dr.
Thank
Eck,
you for having
welcome
me.
to the program.
Thank you.
Good. Now, so you've been doing laser dentistry for quite some time.
Yes.
Okay. Now, gum disease. Give us a working definition. What is it? What are the symptoms?
Gum disease is an infection, bacterial infection, essentially in the ligament space between your tooth and the gum, okay, and the bone. And once it goes from gum into bone, then it's classified from gingivitis to periodontitis. And so it actually starts to affect the bone. The infection's in your jawbone.
So this is like the number one way you lose your teeth?
The periodontal disease is the most common way patients lose their teeth. Yeah, and the reason is you asked me about symptoms. You can have bleeding gums, you can have loose teeth, you can have recession of the gums, you can have bad breath, you can have any or all of these things. You could also have none of them. And so people oftentimes go undiagnosed and untreated because unfortunately this is not a disease that has symptoms until it gets into its later stages.
So like puffy red gums also could be gum disease or are gum disease? Now, teeth that start to move, they get loose. What does this have to do with gum disease?
Well, the bacteria produce toxins that damage the bone and essentially rot the bone away, for lack of a better word.
So the teeth get loose because of that?
Because they lose bone. An analogy I would give you is if I take a 6-foot-long post and put 4 feet in the ground and leave 2 feet above the ground, that's very stable, right?
Yes.
What if I did the opposite? What if I put 2 feet in the ground and left 4 feet above the ground? Okay?
It gets loose.
It's loose, right? So when you have your tooth that's supposed to be 70% in bone and 30% sticking up in the mouth, and you get the opposite, you get bone loss and you get 50% in bone and 50% above, your tooth starts to get loose. As you get below 50% in the bone, it gets even more loose.
So this bacterial infection eats away at the bone goes away and the teeth start getting loose.
Yes.
Or they start to flare.
Yes.
Or like spaces in between too?
Yeah, so if your teeth start to move and they start to flare out, then you get spaces in between your teeth.
You have gum disease.
Yes.
Now, I Googled it. Over 30 million people have an upper or lower denture. Mm-hmm. Most of these people, gum disease.
Most people lose their teeth to gum disease.
With a bacterial infection.
Yep.
Okay, now there's two ways to do it. One way is to kind of cut it out, scrape it out, and the other one is to kill the bad bacteria with a laser.
Correct.
So tell me about the traditional way versus what you do.
A traditional gum surgery, which, it's the best thing we had for 50 or 60 years. It was the only thing we had. The laser's not new, by the way. It's been out. We've been doing it for since 2004, I believe.
Okay.
And it was out for 12, 15 years at least before that. So this isn't new stuff, even though it's not
just become mainstream now.
Not caught mainstream yet, but it's just now becoming that way. But traditional gum surgery is all we had for a long time, and essentially that process it's not a fun process. You got to use a scalpel. You move the gum out of the way. One of the things that you have with traditional gum surgery is you have to remove good bone and good gum tissue to get rid of the bad. So if I draw you a picture of what a tooth looks like, so when we look at an X-ray, or we flap the gum out of the way.
And you draw this with every patient?
I do.
Okay.
If I take 2 tooth roots like this, right? And
tilt that up so we can see what you're showing me.
So I have 2 teeth, right?
All right.
And the bone between the teeth comes flat like that, right? That would be normal. Okay.
And that's holding them in place.
Right. And so this is the part, again, that's below the bone, as I mentioned earlier, right?
Okay.
This is the part that sticks above. If that level gets down here, then you've only got this much tooth under the bone, and that's why it gets loose.
So when you're looking at X-rays, you're actually looking that if the bone is dropping, you probably have periodontal disease.
Yes.
Or like an infection.
Yeah, you have tissue damage.
Interesting.
That's the only thing that causes it.
All
Okay.
right.
But this is the way our bone should look. Okay. When we have periodontal pockets, our bone looks like this. Okay. You get this gap between the root and the bone. Mm-hmm. Okay. Our instruments that we do. So patients come in all the time and say, I've had a deep cleaning over and over and over again. It never works. Every year they want to do a new deep cleaning, right?
Yeah.
The reason is because our instruments that we have do not fit into this little space. So there are only 2 ways to get in that space. If we just do a regular scaling or deep cleaning, we only get from here up, okay? All that gets left behind. Two ways to fix this. Traditional gum surgery. Move the gum out of the way, you see this. You take a drill, you move the bone down, you get to the bottom of that defect till it's flat again.
Okay, well, so they're cutting open the gums and they're flapping them out.
Yes.
In a way, so they have access
to see this.
and then they clean it.
Clean
in
it.
the traditional
Get
way.
rid of the defect. Okay. Suture it all back together. But
Stitch it with stitches.
Stitches, yep.
Okay.
And then you know the old saying, getting along in the tooth, right? Well, this is a resective process. You have to get rid of good gum and good bone to get rid of the bad. So your tooth appears a lot longer. Okay.
Okay.
When we do it the laser way, the laser gets rid of the bacteria that's in there, and we get a regeneration of bone to fill that in. It's a regenerative process. Okay. Much simpler, much easier, and much more predictable than traditional gum surgery.
Does it work? How does it stack up?
Well, the success rate is much, much greater than traditional gum surgery.
Okay, so
this is the only FDA-approved procedure that we have to treat gum disease. It is the only thing that's predictable enough to get FDA approval.
so brushing and flossing is not going to hit that bacteria.
No.
It's not going to kill the bacteria.
Look, your hygienist can't even get in there. You have no shot.
So the only way in the past is to go in there and scrape out the bacteria. But you're always going to leave stuff behind, right?
With the scraping, yes. But when you use the laser goes in, and anything that is unhealthy bacteria in the area gets absorbed by the laser and gets eliminated. Okay?
Okay.
And so it's instantly gone.
Now we have some animation that you brought looking at the laser. Let's take a look at that right now. So what are we looking at?
So what the laser does is it's going between the tooth and the gum, and it's absorbed by the bacteria. The energy is absorbed by the bacteria. So the bacteria are now dead, okay? Then we go in with a piezo instrument and flush them out, okay, and get rid of them. Now, one of the nice things about this is it actually denatures the way that bacteria connects to the tooth. So when we go in and do our scaling part of this, it's real simple. With the old traditional way, people would get out and their teeth would be so sensitive because to get all these toxins off the teeth, you really had to scrape. I mean, you had to scrape. With this, you don't have to do that. So your post-op is not only because you don't have to drill bone and cut gums, but just the scraping alone is so much easier that the post-op is night and day.
Okay. Now, you guys have buttons on your website like it says no cut, no sew when it comes to gum disease.
Right.
That's referring to the old way, which is being done every single day.
Correct.
Which is to open up the gums, get in there, clean it, cut away some of the gum if necessary, then sew the gums back onto the tooth. That's the standard way.
That's correct.
Is that a common procedure? Like, let's say in Florida, there's hundreds of periodontists. Is this something they do once a month? Is this every single day?
This is pretty much every day in a periodontist office. This is what they do. And fortunately now, but unfortunately in the past, the majority of periodontists did not do the Lannett procedure. They did traditional gum surgery. And today you still have a large percentage of doctors that do traditional gum surgery as opposed to laser treatments.
Okay, now you said that people that you would have extracted their teeth years ago couldn't save those teeth. Because of this laser, you could save teeth. And you say losing teeth is expensive. Elaborate on that.
Well, when you lose teeth and take them out and have to do implants and everything else, bone grafts, sinus surgeries in order to replace your teeth, it can be very costly. It can be $30,000, $40,000, $50,000 per arch, per upper, per lower. We now save. When we got these lasers, our number of implants we did per year went down because we saved teeth that in the past we would never even attempted with traditional gum surgery. And some people come in to us because they know we do this. I had a gentleman come in probably 8 or 9 years ago, one of my favorite patients ever, James. And he came in and we were like his 5th or 6th opinion.
Okay.
And my staff gets his images up, I'm looking at him in another room, waiting for them to get done going through his medical history and stuff. And I'm looking at him like, the guy needs his teeth out. He needs implants. He's got no bone. He's got like 70% bone loss. His teeth have to be mobile. It doesn't look like he's had his teeth cleaned in forever.
Yeah.
So thinking to myself, why is he here? He's been 5 other people. Surely that's what they told him, right?
Yeah.
So I walk in the room, introduce myself, I'm chatting with him, and I said, I assume you're here because you want to save your teeth. He sits up, looks around, and says, how do you know this? I said, well, because if you're going to come to the fifth or sixth opinion, I know what the traditional opinion would be. I know what my traditional opinion would be if you were my brother, or what I would tell you to do. Take out your teeth and do implants. It's very predictable.
Okay.
Saving your teeth is not predictable because you have mobility, and what it takes to save your teeth is a lot, okay? Because if you can just go in and do laser treatment, okay, and by the way, that's what he said. He goes, I'm here because I don't want to lose my teeth, right?
Okay.
And so I look at him and I say, okay, I can save your teeth, but let me explain what it takes to save your teeth. We can go through and do the Lannat procedure. I can do the laser. That's easy. That's real simple.
So first you go in and disinfect and kill
Get rid of the bacteria.
the bacterial infection.
Right.
Okay.
We do it in 2 appointments. Do the left side one day, a week later do the other side, and that's done. And for most people, they would be done.
And the breath, bad breath goes away,
It all goes
bleeding
away.
gums goes
The
away.
bleeding,
Okay.
all that stuff. Sensitivity. His problem is he had so much bone loss before he got in that his teeth are moving. Well, the laser treatment won't work. No periodontal treatment will work. No grafting will work.
Couldn't save
if
the
your
teeth.
tooth is moving.
Okay.
Okay. So we have to control the mobility of the teeth. So I said, James, we can save your teeth, but I got to stop them from moving, which means I got to crown from molar to molar, upper, and make connected crowns so it goes in as all one piece. So I stop the movement. I said, so you're going to spend $30,000 on crowns alone between the upper and lower, plus the laser treatment. He said, how long can you get me, Doc? I said, it's unpredictable. As doctors, we like to do predictable stuff.
Okay.
We don't like to do unpredictable stuff. So when I have to sit there and tell you, I don't know how long it's going to last, that creates anxiety for me, right?
Yeah.
I said, but I could probably get you 2 to 5 years. He goes, you get me 5 years, I'll be ecstatic.
All right.
So you're willing to spend $40,000 to keep your teeth 5 years, right? Other people come in and they're easily treated and they don't want to keep their teeth. They're tired of dealing with their teeth. So you gotta learn who you have and what they want. So we treated James, and he ended up becoming one of my favorite patients. We got him treated. He's done. He was so happy. I used to see him out. We'd go out to dinner
Yeah.
or lunch, restaurants. I'd walk across the parking lot of a restaurant, and I'd hear him. That's the doctor. That's my doctor. Saved my teeth. He referred me more patients. It was incredible because we saved his teeth. We did what nobody else wanted to do for him because everybody wants to push the implant thing now. And that's fine, but when somebody wants to save their teeth, you give it a shot.
So in your practice, I mean, many people come in, they've already self-diagnosed, they've done the research on the internet, and they say, look, I need all my teeth out, I need implants. And sometimes you have to slow them down and say, we could save these teeth.
Right.
Is that right?
And it's just the opposite of James.
And it's a lot less expensive.
It's a lot less expensive for most people. But it's also, what we do now is some test, okay? We do a lot. I want to finish up something with James.
Okay.
James got inoperable cancer about 6 years after we treated him. By the way, his teeth lasted 6 years. And he passed away several months after that. His wife, by the way, I didn't realize this, was not a patient of ours. After he passed away, she sent us a letter thanking us for what we did for James.
Nice.
How excited he was to actually save his teeth. So it meant that much to him. So coming back to the question as far as when people come in, do we take out their teeth? Do we keep their teeth? How do we make a decision?
Yeah.
There's a lot of testing out now, a lot of lab stuff. You go to your physician and you say, Doc, I don't feel well. He takes your blood pressure. Your blood pressure is high. You don't just start doing meds and stuff. There's a diagnostic process, right? Do you have any high cholesterol? They do blood panels, right?
Yeah.
Determine what's good for you. Right? So now in our office, we don't do any periodontal treatment of any kind without what's called an oral assessment. We take a saliva test and a finger prick. We send it off to a lab. The results come back from them, and then we have information. Now we can better advise you what to do. Okay? It gives us your bacterial profile. I'll show you an example.
So this is some sort of a lab test that measures the bacteria in their mouth.
It measures the bacteria profile, so
Okay.
it tells us which, because there's about 11 different bacteria that are commonly causative of periodontal disease. Okay, it tells us which ones you have and the levels of those. It also gives us your A1C, so we can do a quick blood sugar screening to make sure we probably have 20 people a month more in our practice that we diagnose with diabetes that didn't know they were diabetic. Okay, which is contributing to their periodontal disease.
Okay.
And we diagnose multiple people a month with what's called insulin resistance, that pre-diabetic range.
Okay.
But insulin resistance, by the way, puts somebody at 3 times greater chance of having a heart attack or a stroke. And it's reversible. So it's important to find those people. The other thing it gives us is what's called their C-reactive protein. Okay. Their C-reactive protein is something that's produced in the body in response to inflammation in the bloodstream. Okay, it gives us an idea of how much is this bacteria and this infection having an effect on you systemically. Okay,
right.
The last thing it gives us is what's called interleukin 6, which is how your body handles bone turnover. Okay, and if somebody comes back high on that, then that puts them at higher risk of not healing. So it just allows us more information to make a decision.
So with the lab work, since you now know what the bacteria is, you can target treatment based on the bacteria they have in their mouth. Correct. The bad bugs.
Right, because it will allow us to then use maybe a different spectrum of antibiotic as part of our regimen. And the laser would be the same because we'll go through and eradicate it and get rid of it. But then the medications that are used, also their follow-up. What products they use at home afterwards, how often they have to get their teeth cleaned. Because if you have the more aggressive, virulent type of bacteria in your mouth, two things. One is they'll recolonize your tooth in about 3 months and start to produce the toxins that cause the tissue damage. So if you have those, you must get in every 3 months and get your teeth cleaned. If you don't, they'll start to create toxins and put you right back to square one again.
So nobody wants to lose their teeth, right? Nobody.
Some people do, but most people don't.
But if you have a bacterial infection, you have two ways to do it. Cut it out, and then it comes back. And these people, like you say, they have to keep coming in for deep cleanings for the rest of their life. Whereas when you do the laser, disinfects, kills the bad bugs, they're not in this vicious cycle of getting deep cleaning after deep cleaning. Correct. Is that true?
Yeah, the goal is to keep it away. And these tests allow us information to help us know what it's going to take to keep it away.
And that's not always being done. Like rarely done?
It's, you know what?
Like less than 5% of dentists are probably doing it?
Less than 2% of dentists.
It's not that expensive, so why aren't they doing it? In your opinion?
In my opinion, doctors hate change.
Okay.
Not that this is new. This has been around for years and years. But they just want to do what they do. And if they get a test result back that changes what they're going to do, they don't like that. They want to do what they do, right? They want to cut and sew and move on and just do this and do what they've done for 20 years.
So I told you at the beginning of the show, I Googled, there's like 30 million people with an upper lower denture. Do you believe, and this is just your opinion, that if you would have got these people early enough, you know, aside from accidents, however they lost their teeth, but with gum disease, if you could have got them early with this laser, early on, do you think that these people wouldn't have lost their teeth?
Not only can we save their teeth if we get them early on, we can actually do things that will tremendously affect their life. So if you look at this particular profile here, I want you to notice the one thing on here, the C-reactive protein I talked about earlier. Less than 1 is normal. Greater than 3 is high.
Means you have inflammation.
Okay?
You have a problem.
Means you have tremendous amount of inflammation.
Your body's fighting something.
Yes.
Okay.
And your body's reacting to this by producing the C-reactive protein. Most physicians won't pull the C-reactive protein. The only people that really pull this are cardiologists because it's direct link between heart attacks and strokes.
Yeah.
Okay. And wellness doctors who do preventative medicine to try to make sure you're not having a problem, right? So this gentleman, his C-reactive protein is 12.1.
It's supposed to be 1.
Puts him about 5-6 times greater chance.
Okay.
Anything below, cardiologists want this number below a 2 usually.
Okay.
Okay. Above a 3 considered high risk. He's 12.1. Okay. By the way, he has a history of cardiovascular events. Okay. So this infection can directly be causative to his problems.
So what did you do for him?
So in his case, we treated his teeth with the laser. He had to do some bite work because, again, he was getting mobile teeth. So you have to control that. But instantly, you do the laser, and that bacteria is gone.
So is it like any other, like for example, if you have the flu, you have a bug that's making you sick, you know, it robs you of energy. So this bacterial infection, so once you go around the mouth with a laser, clean it up, do these people report they feel better?
Oh, they routinely, how much better they feel all the time. All the time.
Okay, so this laser, and you showed me a video, and we're going to go to this clip that you brought. So this bacteria in your mouth that makes you lose your teeth has a color. The laser picks up that pigment and kills it, right?
Bacteria that create periodontal disease have dark pigments in them.
Okay.
And so the beauty of this laser is that it is absorbed by things with dark pigments.
Okay.
Okay. So if we look at the video,
Yeah, let's take a look.
you'll see with the video what it does is you'll see the laser, if I apply it to my finger, it doesn't do anything, right? Because there's no dark pigments, there's no infection. But if I put it against a simple carpal of anesthetic with black lettering, you'll see the black lettering disappear instantly when I activate the laser, because that dark pigments of that color absorbs that laser instantly. When you put that laser under the gum, any of those bacteria, just like that laser disappears, they vaporize. They're gone.
So could this end tooth loss in a way? Let's say the future.
Drastically reduce it, for sure. Drastically reduce it.
Because if the bacterial infection is what's causing people to lose their teeth, if you're able to treat it with this laser, then theoretically it could, like in the future, maybe people won't have dentures. Do you think that's the future of dentistry? Where even your hygiene appointment, they go around your mouth with a low-level laser or something?
And we do this. So there are people that come in that have, 1, 2, 3 isolated spots, okay? Or they've had a long history of periodontal disease. And so we'll do, instead of the full LANAT procedure, we'll do what we call laser-assisted scaling, where we'll go through and just do a quick pass around the teeth just to knock out any, the old way of doing this was hygienists would go in and put these antibiotic pellets and stuff underneath the gum. They don't work. And to try to eradicate these areas as they start to try to creep back. This is very simple and easy to do. You don't need to go through full treatment again. And it helps
you end up with
tremendously.
great teeth again.
Yes.
And they're solid. You could bite into things. Now what about the Whole Foods crowd, this health crowd, that they don't want antibiotics? We have people on the show, against antibiotics, only in like a life-death situation. But are there those people that can get results without antibiotics? You just use the laser?
With the laser, okay, we can get rid of the bacteria. Remember, they vaporize, just like that lettering on that carpule, right? They vaporize, they're gone, okay? Keep in mind, antibiotics in the mouth isn't as critical as it is in the rest of the body, okay? You get a kidney infection, and you take an antibiotic, it goes away, right?
Yeah.
You get a bladder infection, you take an antibiotic, it goes away. The mouth doesn't work like this.
Okay.
The mouth works like a splinter, right? If I get a splinter in my finger, it doesn't matter what I take. It sits there and festers until I take the splinter out, right? That's how teeth act. That's why taking antibiotics alone will really do next to nothing for a dental problem, okay? Now, if we go in with the laser and treat the infection with the laser, we can use none or very little antibiotics compared to what we would have to do if we did traditional methods of treatment.
Okay. Now, in your family, have you used the laser on any family members?
I have.
So you would never put somebody through the traditional surgery?
Oh God, no.
There
are no reasons to do it. In my mind, there are absolutely zero reasons to do that procedure.
The big key thought leaders in perio are all making the switch. They're all doing it with laser. And I said, well, why? Because logically, if what you're saying is true, I still struggle with why aren't they all doing it this way? If it's a bacterial infection, why aren't they treating it like a bacterial infection rather than trying to cut it out?
Well, it's what they learned. And doctors hate change. And they want to do what they've been taught 20 years. They don't want to add new equipment. They don't want to fly out to California for training. And at the end of the day, they can't use the money as the excuse. It's so much easier for the patient and so much less time for the doctor. So in one area with traditional gum surgery, all of our time and expenses in our time, right? With the lasers and the technology and the training, you just swap one for the other. It doesn't cost us more to do the laser than that. It just takes so much more time, and the time is more valuable.
So no more bleeding gums, bad breath, loose teeth, puffy red gums. That goes away?
That goes away.
How soon after the procedure?
Oh, well, the puffing, it's hours or days. So usually we see people 7 days later for a post-op infection, and their tissues in 7 days look fantastic.
So why the bad breath? I mean, what's causing the bad breath when you have gum disease?
That is the bacteria. So
are you smelling the food trapped in the teeth, or
you're smelling the bacteria. The bacteria produce toxins that cause tissue damage. It rots bone. You got rotting flesh. You got rotting bone.
You can't floss and brush that out.
Absolutely not.
But that's what people are trying to do.
I know, and they have to understand that these bacteria are transmittable. They can give these to their kids, their grandchildren, their spouses.
So this, in a way, is changing dentistry. This laser to get rid of the bad bugs in the mouth.
Absolutely.
Now, we have another slide. It's a very interesting slide. It's one of a bunch of bad bugs in the mouth. Like they swab the mouth, put it under a microscope. So I guess you got a bunch of things swimming around.
What the first slide shows is a swab prior to treatment.
Okay.
And we can see. So it's normal to have bacteria in your mouth. just like it's normal to have bacteria in your stomach, right? What causes a problem is when we get the wrong kind of bacteria in there, and the wrong kind of bacteria get at elevated levels. So when we look at a normal swab, we shouldn't see certain kinds of bacteria,
like all
the
these swimming
spirochetes
things.
and the swimming ones, and the ones that look like rods, the spirochetes. Those are bad ones, right? So when you see those, you have a problem.
So you go in with a laser, and then this after.
Yeah.
So they're what? Kind of floating dead?
Yeah. So one, again, it's normal to have bacteria. Okay. So the bad ones are gone. Okay. And that's why you don't see movement, and you don't see the ones that look like little rods. Okay. Because those are gone now. Those are the ones that cause a problem. It's normal to have some bacteria, but the ones that are normally there, you don't see them swimming and being aggressive and doing stuff like that.
Now you have multiple practices. So are you using this in all of your practices? Or?
Yes.
Okay. So you couldn't practice any other way now?
Oh, no.
Without that laser?
Absolutely, absolutely not.
Because you have to leave your practice, go through a training, buy this machine. Right? It's like a $100,000 machine.
Yeah. And one of the great things about this company is they care about the quality the patient gets. Okay, you can order almost any other laser on the market. Give them a credit card over the phone, and in 2 days, it'll be in your office. No training, no nothing. Right? With this laser, they will not ship this laser to your house or your office until you've actually gone out, been certified, so you don't do it wrong. So that's one fantastic thing about that company.
So periodontists are doing this, general dentists are doing this. You say there might be a slight advantage by going to a qualified general dentist that has the laser and has been through the training. Why?
Well, the reason is because there's a lot of contributing factors. One, you need regular recalls, okay? You want to make sure you're in an office that they have regular recalls. You're going to be seen every 3 months for your
like
follow-up.
A hygiene team,
have
things
plenty
like
of
that.
hygiene team, okay? Second thing is there's contributing factors to almost every case, okay? And if those contributing factors are not dealt with, okay, and if all you do is go in blinded like this and all you do is look at the gums, you miss the contributing factors. So for instance, if you have mobile teeth because of your bite, you might need a bite adjustment, or you might need bite work in order to make this last long term. It's important to do that.
And that's one of the advantages of the general dentist, because you also fix the smile.
Because you fix the contributing factors, the bite or whatever it is.
Okay, so no more gum disease. You think you can wipe it out in Florida?
We're going to
Probably
try.
not. I want to thank you for coming on the show. Great stuff. And you have a free consultation, right? If somebody wants to go in?
Well, we don't charge for consultations. If they need the assessment, then we send that out to the lab. They got to pay for that. But we don't charge for consultations, so we don't charge for the imaging to look and see what's going on.
Okay, good. All right. And final message, somebody watching this and they're still skeptical, what do you say?
Go to our website. There's testimonials, there's photos, bonitadentalcare.com, marcodentalcare.com. You can get a lot of information, but it's very predictable, very easy to do.
All right, great. Dr. Eck, thank you for coming on the program.
Thank you for having me.
Good stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.